Why, hello, plant-based buddies. Happy Monday. I have about 10 minutes before my first patient from the afternoon starts. So someone asked me this morning about foods for cancer, so let's talk about them. So let's start talking about foods that maybe contribute to a higher risk of cancer, and or I would even say for things that contribute to the risk of cancer. Typically, we would see increased cancer risk in those who smoke, okay, in those who consume alcohol, and also in those that consume ultra-processed foods, and those that consumed red and processed meats. So these are about the four groups of substances and foods that would increase cancer risk. Now, I believe in science. I believe in not trying to scare anyone. That's why you don't get cancer because you've smoked one cigarette, and you do not get cancer because you eat ultra-processed meat or foods once. It is the accumulation or the cumulative risk over time, over years, over decades, that contribute to the overall risk. The question always comes back to, if ever you get a diagnosis of cancer, you'll be likely you'll be re-evaluating your life and re-evaluating your life choices, looking back on things you've done and decisions that you've made, and you're likely going to be seeing or reflecting on whether or not these indulgences were worth the risk. Now, I'd say most people who do suffer from a disastrous diagnosis like cancer typically would say no, would say that bacon wasn't so good and that it was worth the cancer risk. People that have a lot of addiction to alcohol or smoking might say that it was worth it. I've heard people say I'd rather die than not have my alcohol or not smoke, but these people are typically dependent on these substances for quality of life because of underlying mental health disorders, or these substances are typically so intertwined with who they are and their social life and their identity that patients can't imagine stopping them. Same goes with certain types of food. I think some people will say, I could never see myself cutting out dairy or cutting out certain types of foods until sometimes it's too late. So just kind of keep in mind that on the spectrum of contributes to cancer, we'll see red and processed meats. Red meat, I think everyone knows what it is. Processed meats, ham and deli slices, bacon, jerk meats or beef jerky, and sausages, wieners, bologna, all meats that have been dehydrated, salted, cured, smoked, or canned. You get the point. Now, just a simple anecdote, our schools use beef jerky for fundraising at our school. So, I mean, we're having our kids sell class 1 carcinogens and processed meats as a way of funding activities for our school. Let me know what you think about that in the comments. I'd be curious. I know that it preserves well and people buy it, so that's why it's there. And I do understand that a lot of local companies are making them locally, and people want to support local. So I do understand that. But having a class 1 carcinogen sold by our school kids in order to raise funds for activities, I kind of find that bizarre. So in terms of causing cancer there, in terms of preventing cancer, I'd say any food that has plant defense chemicals. So cruciferous vegetables are probably, so Brussels sprouts, cauliflower, kale, broccoli, have plant chemicals or polyphenols and other phytochemicals that have been proven to delay and to prevent cancer. I think that a plant, if we're looking at specific foods, these foods will definitely help reduce the rates of cancer. But if we look at dietary patterns, the plant-based diet is definitely one of the best ways of reducing, and if not the best way of reducing your cancer risk over time. Now, certain foods fall in the middle, okay? I'll give you an example. Dairy consumption is associated with increased rates of hormone-dependent cancers, maybe breast cancer, endometrial cancer, and prostate cancer, although we're going to need more science to kind of confirm that for sure. But the high calcium content of dairy is actually thought to be protective against colon cancer. So you see that there are pros and cons of consuming dairy if you're able to turn a blind eye to the negative impacts on climate and on animal cruelty. But in terms of health outcomes, we do see dairy being associated with certain cancers and protective against others. As more data is coming out, the IGF-1, which is the insulin growth factor 1, which is a growth factor that we see in dairy, is likely to be associated with other types of cancer as the science grows wider. Other foods, like probably seafood, although they are often contaminated with heavy metals, dioxins, and other persistent pollutants, have yet to be shown to be directly associated with cancer. But as nutrition literacy and nutrition science evolves, that might happen over time. So, and the most important thing is to measure risk of cancer, we have to measure that behavior over time. If you go online, people tell you that this substance or this ingredient causes cancer. One of the worst carcinogens that we have is smoking, and people do understand that you have to smoke many packs every single day for a longer periods to have a measurable increase in cancer risk. So it's not because you ate bacon once that you're gonna get cancer, okay? I personally choose to put all the chances on my side and eat zero, but I mean, I do understand that that might not align with a lot of people here. And the most important thing is I don't want to scare people into changing. I want people to have information and then to decide what they want to do. I decide to avoid processed and red meats for health reasons, ethical reasons, and for the climate. If you're doing it simply for health, there is maybe a healthier dose. But I think that studies start to measure an impact over, I think it's 50 grams per day. Don't quote me on that. I have to review that. But 50 grams is about half of the size of a deck of cards. So if you're eating that quantity in red and or processed meats, you're getting a measurable increase in your risk of cancer. So voila, I think there's no magical foods that protect against cancer unless you use them as medicine. Just as smoking one cigarette won't cause cancer, eating one piece of bacon won't cause cancer. It's behaviors over time that determine that, and much in the same way as eating cruciferous vegetables once a month is not going to protect you against cancer. It has to be integrated into your lifestyle and used as medicine, so used almost every day. Cool. Right on. Have an awesome day. Peace.